Vitamin D and colorectal cancer risk. Let's talk about it. So, there was some research that Danielle and I were reading this week, specifically talking about vitamin D's role in terms of protecting against colorectal cancer. So, yeah, where do we start? Tell me a little bit about what you gleaned from that study.
Yeah, there's lots that we can unpack here. So maybe first things first, I'll start at the fact that when it comes to vitamin D in North America, there are a lot of people that are low in vitamin D. And we are also seeing an increase in the instance of colon cancer across North America. Of note, of course, too, I'm sure maybe you are watching, you have IBD, just like myself and Ashley. And vitamin D and colorectal cancer are something that we need to be mindful of because when we have IBD, we of course too are at increased risk for colorectal cancer. And more often than not, we may also have low vitamin D. So we want to make sure that we are taking a peek at our vitamin D levels for many reasons. And Ashley, should we maybe dive into what vitamin D does before we dive into a lot about what
Yeah.
the study said?
So, in vitamin D is So in IBD specifically, I think the stats like 30 to 40% of us are low. Quite and it is involved in inflammation reduction. So it's a hormone, so it regulates a lot of things, but in particular, it's important for the immune function and also important regulator of inflammation. So keeping it lower because there is some correlation between increased risk of flare up and lower levels of vitamin D.
Yeah, vitamin D, important to see what your values are at because it is very difficult to get from food. I believe that now I'm not recommending this. I'm just saying that I believe that 5 cans of salmon are equal to your daily dose of vitamin D that's recommended.
And that's just baseline, like if you're deficient, it's not going to cut it. A lot of people will ask about, well, can I get it in food? If you are deficient, it's not one you just want to like play around with. You definitely want to get the right dose range. But it's important to get in the diet too.
Absolutely, yeah. So what this study said is that the study suggests that higher vitamin D levels may lead to lower rates of colon cancer. And that's pretty dang cool because I mean to me, that's something that you can check off on your to-do list to actively work on.
Did they give a range? Because I know, because technically the range of normal, according to a lot of labs, is like 30 and up. But I think most people that are IBD, specialized GIs, and like people that are really dialed into what's important for IBD and dietitians will often say, 30 and 40 is kind of not ideal. It's not where we want a lot of people to be. We want kind of people to be further up, but did they have a range in particular that
Let me check.
I mean, it's important to know too that as dietitians, we actually look at this stuff. We're not quoting something random or making something up. Like we're actually making sure that you are giving the right information.
Absolutely. Okay, Ashley. So in the study, it was found that raising 25 hydroxy vitamin D concentrations above the 30 nanogram per milliliter of vitamin D can significantly reduce the risk of common causes of death, such as heart disease, cancer, particularly colorectal cancer. That's the main one we're talking about, but breast and prostate cancers as well. It can also decrease death through stroke, high blood pressure, chronic respiratory diseases, Alzheimer's disease, diabetes, kidney diseases, and COVID-19.
So
Wow.
basically what you're saying is if it's at the minimum of 30, that's not really the ideal because we know if you go above that and we get it into further the ideal range, then we have better outcomes overall, better cancer risk mitigation as well.
Yeah. Yeah, which is cool. And then it was also said that vitamin D supplementation is the most effective method for increasing those vitamin D concentrations as it can be carried out year round and under, of course, controlled conditions. So relying on the vitamin D supplement instead of your 5 cans of salmon. Again, not recommending 5 cans of salmon in your day, but vitamin D supplementation is helpful. And that research indicates that a daily dose of 2,000 international units is the optimal minimum dose for adults of normal weight.
Yeah. What's interesting about that is I've seen people be recommended the 2000 IUs when their vitamin D is like tanked, like it's very, very low. And I'm thinking if you're low, you're gonna need more dosing, like as if you're deficient, not necessarily like a minimal dose. But of course, definitely talk with your doctor or dietitian about like what that dose should be for you. Don't guess on it. You can overdo vitamin D if you're going beyond what is needed. But definitely, we don't want to underdo it either, because it can be one of those things where we want to try and mitigate risk as much as we can. And that's one way of doing that, is to make sure your vitamin D levels are optimal and that you're testing regularly. And so regularly, to me, if you're someone with IBD, would mean at minimum yearly. And if you're deficient quite often, I would say maybe every 6 months doing some kind of read, especially as you head into the winter months, if you're living in like a colder climate.
Yeah, absolutely. It's very individualized, because not only do you consider climate, but someone's health status, your age, are you pregnant or not? And yeah, what are your vitamin D levels? So talk to your healthcare provider about it. Maybe tell them about this YouTube, or even the study that we're going to link below too, so that they can take a peek for themselves and just learn more about vitamin D.
Yeah, and like to just tack on a story about how we see this play out all the time. We've had many patients that we see that have high inflammation and maybe are malnourished, and then when we work on their nutrition side and we actually check for things and request that their provider run vitamin D panel, what we'll find out is, okay, they're suboptimal or even deficient. And then when we work on that piece, plus making sure they're getting other baseline needs met, it's amazing what the outcomes can be, because they start responding to meds better. And sometimes we need both parts of the puzzle. Meds are very important, but sometimes it's only part of the puzzle, and you don't respond as well as you would as if you were in a more nourished state. Vitamin D being included as a part of that nourishment side.
Mm-hmm. Absolutely. Well said, Ashley.
All right. I hope this was helpful, everybody, and make sure to share and like our YouTube, subscribe, so that we can continue making videos for you. All right. Take care.